So there's rising concern about the high rate of pregnancies at the country's schools. The Ministry of Basic Education tabled before Parliament a figure of 90,000 pregnant learners across the country. The age groups are disturbing: over 8,500 teens between the ages of 15 and 19, and almost 300 between the ages of 10 and 14 years of age who had deliveries in health facilities between April 2021 and March this year. To find out what is to be done, I'm joined by the Chief Director of Care and Support in Schools for the Department of Education, Coceka Nogoduka. Good evening and welcome to the program. As an opening, just share with our viewers what your role entails.
Good afternoon, Imani, and good afternoon to your viewers at home. So as the Chief Director, Care and Support in Schools, I'm responsible for supporting the Department of Basic Education health promotion, which includes HIV and teenage pregnancy. I'm responsible for psychosocial support provision in our schools, as well as the National School Nutrition Program.
How are you leading a strategy then to create or support existing school programs to prevent what we're seeing happening?
As the Department of Basic Education, we provide the comprehensive sexuality education. This is taught by teachers in the classroom, and this is where our learners will learn about their body development. They would learn about sex and sexuality. They would also learn about human rights. Within sex and sexuality, we also teach our learners about sexual assault, sexual abuse, and identifying signs of people that are interested or preying on them as learners. Also, as a department, we provide, working with the National Department of Health, integrated school health services, and this is where we provide sexual and reproductive health services in our schools, and contraceptives are part of these sexual and reproductive health services that are provided in schools to make sure that our learners get access to SRHR services. We also, as a department, lead through the school safety framework, making sure that our schools are safe, making sure that our learners know what is right and what is wrong, but also ensuring, working with communities around our schools, our learners are safe en route to the schools.
Coceka, given what you've described for us now, and given the fact that year on year these numbers are rising, Parliament hearing just over a year ago about the unacceptably high rates of births to girls between the ages of 10 and 14, 30,000 in the first quarter of 2021. The total number, 130,000 for 2019, 136,386 for 2020. It's rising year on year. Are your programs effective? Do you think they are?
Imani, our programs are effective in the sense that learners are now able to report who impregnated them. You would remember that according to the South African laws, children between the ages of 10 to 15 are not supposed to be having sex. They are unable to consent to sex. Therefore, if a child is between the ages of 10 to 15 and is pregnant, that is regarded as statutory rape. So the programs that we are implementing as a department actually are effective because now learners are able to report pregnancy. But as a country, we do have a challenge. Learners are impacted by the high rise of gender-based violence in the country. Therefore, we have a challenge. But also, Imani, we do have a challenge with our parents because as the department, we are unable to provide these services to our learners if the parents do not consent, if the school governing body of a particular school does not allow these services to be provided in schools. Therefore, we are appealing with our communities, with our parents, to allow the education sector to provide these services, bring all the relevant resources and also collaborations to make sure that this department is able to provide services and learners are able to access these services so that we can be able to protect our learners.
So the part where, you know, the information and the data then, or the ability of those affected to be able to say what happened to them, to be able to identify, and we'll get to exactly who these people are and what's being done about them, you would rate as a success, and it's good to hear that. But one of the core, strategic focuses of the program is meant and aimed at prevention. Why has it not been as successful in prevention?
Imani, as I've indicated, we do have challenges. Remember, learner pregnancy or teenage pregnancy is really broader than just a girl child having sex. I've touched a little bit about issues of gender-based violence, but we also have older men that are preying on our children based on their economic status, promising them or providing for them cell phones, providing any other materialistic things that the learners would then require, and also then abuse these learners. Therefore, the prevention of pregnancy amongst teenagers is not a straightforward issue as a girl knowing what needs to be done or what not needs to be done. If I'm having sex, I should then access contraceptives. You'd find that most learners that do get pregnant, it was their first sexual encounter, and the sexual encounter was not consensual, and the learner was not intending to get pregnant. Therefore, as much as we are saying the programs are effective in giving information, in advising what you need to do, but the environment or the society that we live in does not make these programs conducive or produce the results that we want to see as the sector.
So given what you've just said then, it gives us a better sense of the profile of those who are preying on children and on learners at school. And in some cases, some would argue in the majority of these cases, there's a huge element and presence of criminality. What is the core profile for those who are preying on girls at school across these different age groups? What is your data telling you based on the fact that more people are saying this is how it happened and this is who's responsible? And just a quick addition, teachers especially, how complicit are they? How involved are they?
Imani, the data that we have, we access it from different sources, Department of Social Development as well as the Department of Justice, because these are the departments that are responsible for questioning the learners as well as processing in terms of ensuring that the perpetrators are brought to books. In terms of our educators in schools, we do have figures that contribute to these to being perpetrators of sexual violence or sexual abuse of our children. And SABC, which is the Council for Education in South Africa, also have a responsibility to deal with these teachers that prey on the children. In terms of the profile, as I've indicated, you'd find that children are impregnated by older boys or older men that have some kind of a financial muscle to be able to provide other resources that the learners would see that they need or they would deem that they need, depending on the circumstances of the learner. Some learners, which is much more troubling, are learners that these perpetrators will be providing food at home. And even if the learner is pregnant and is ready to report, but the home will be indicating that we will manage this in our home, we've got our traditions and we've got ways of managing these issues, so we don't want government or we don't want education involved. But then you find taxi drivers, you'd find other people that have other means of finances, but also men that are sitting at home, staying at home and not working, that are preying on our children as mothers and families go to work and leave children getting ready to schools. The neighbors, people in the neighborhood, they also prey on these young girls.
Coceka, we're out of time. We've got to leave it there. Again, it's one of those topics that warrants a bigger and deeper conversation. Thank you for sharing what you know with us. DBE Chief Director, Care and Supporting Schools, Coceka Nogoduka.